Yeah, hello, welcome again. I'm Dr. Tushar Deoras, Chairman, Astute Academy. So today we are going to discuss about the medical post-graduation. You may be knowing in India, the MD, MS admissions are very tough. There are very few seats and large number of students attempting for NEET PG exam. The Indian MBBS seats are also increasing year by year, but in that proportion, the medical post-graduation seats are not coming. So there is a lot of reliance onto the international education. You may be knowing National Medical Commission is the umbrella body which decides who can practice in India and who cannot practice in India. And National Medical Commission has approved US, UK, Australia, New Zealand, Canada. The 5 countries, if you do a post-graduation and then you come back to India, you can practice from the day one. There is no examinations in India. There is nothing. These 5 countries, US, UK, Australia, New Zealand, Canada, is also considered as a global recognized degree. You can go to any countries, you will be able to easily get the licensing in those countries. So it is very critical that we need to go to these countries. So out of these countries, US has always been a leading country. US has got 2 programs, Residency and Physician Associate. So every country, whichever country you want to go, first you have to clear the licensing exam. So US has got US medical licensing exam. It is a licensing exam. It is not admission exam like a NEET PG in India. UK had a PLAB exam which they scrapped it and they put it in USMLE. Australia has Australian Medical Commission exam. New Zealand, Canada, every country has got their respective licensing exam. The purpose is to filter the students. They should have the basic knowledge to practice medicine. That's the objective. The whole world now, including India, which will be having national exit exam soon, will be on the single theme. If you can diagnose a patient, you can treat a patient. So diagnostic is going to be the most critical component. And for diagnostic, it is not the theory part of it, whether which you study in the college or in the classroom scenario, but it is the hospital which is most critical. You should have the patient interactions. As much time you spend in the hospital, as much variety of the patients you have to look at, that will improve your diagnostic skills. And these are the skills which are used in all licensing exam. In United States, large number of students going for rotation. We have almost more than 450 hospitals, either directly or through our partners, where we send the students for all specialties. And what is very critical, when they go to the United States, they will be working with the best of the doctors. They understand the American healthcare system. They understand how the diagnosis be done, which may be slight differ as we diagnose here in India. Same with other countries. US has got a very structured process. In fact, all 5 countries, US, UK, Australia, New Zealand, Canada, is a free education. There is no fees in the colleges for medical PG. In fact, in USA residency program, they pay you the stipend, $5,000 to $10,000 per month you will get a stipend. In India, we pay huge amount of money if you don't get a government college. In private and deemed university, cost of, particularly if you want to go to top 5 or top 10 specialties in India, particularly clinical and surgical specialties in India, is very competitive. You need to get a good marks in NEET PG. At the time, it is very costly part of it because of number of seats. But United States pay you in platter. So since 2023, actually new admission season has come and new admission processes has come in United States. So USMLE or any other licensing examination has got a 15 to 20% weightage, not more than that. So what is 80% balance, which is most critical component, is your academic, non-academic profile building. You have to do voluntary work. You have to work with Rotary. You may be good in sports or cultural activity. Second is a research program. Very critical part of it. You need to do 4 or 5 research projects. You have to do it at the publication level. And it is not a group projects. You need to do now the individual projects. It is very important. Contribution to the project is known. So we have a team of doctors, researchers who will guide you for the research projects. We will tell you what is to be done, what not to be done, how the research are done, and we will take you to the publication. It is a structured process in United States. 10 experiences. The ERAS, which is electronics application system, is very robust. So you, as I was telling, the voluntary experiences to your hobbies, everything, 10, we don't require 11, we don't require 9. And then the next step is complete admissions part. Where to apply? Most critical. People don't know which college is good, bad, where I can apply. If everybody applies in India to AIIMS, not everybody will get AIIMS. You have got a medical college based on your choice, based on your marks, your profile, not just your desire. Okay, I wanted to go particular. So when you go to United States, there are more than 40,000 programs. Out of that, 12,000 programs are available to international. Now, you are not going to apply to 12,000 programs. You may apply selective. Where to apply? People know New York, New Jersey, California. Pile up of application goes into that. And other states, the seats are vacant. And then the match and soap process, very, very critical. The person who devised the algorithm for match, which is the admission process, it is based on 52 parameters, got a Nobel Prize. Understand particular process which person has got Nobel Prize, how complicated it will be. Most of the student doesn't understand. So even a great profile of the students doesn't get a residency program, and average students may get a residency, because if you comply with the complete guidelines, you will get an interview calls later. You need to definitely do the USMLE step 1 and step 2 CK. Step 1 is pass and fail. But step 2 CK, you need to get 250 marks. It is not a difficult to get it out of 300. If you get less than 250, normally we suggest you to take the step 3 examination, which is again not a very, very difficult examination. USMLE, once you pass 7 years, you cannot repeat. So it is going to be very, very critical. So we are last 25 years handling complete end-to-end residency program. So build starting identification of your profile. 3 months we will give academic and non-academic schedule. Every month we monitor of that schedule, and then we build your profile academically, get a research project, help you for USMLE, complete admission, visa part, and getting residency admissions. It's based on strategy. If you are not comfortable with the USMLE examination, or you feel, okay, USMLE is a difficult examination, no worry. There are parallel programs where you don't require the USMLE to do post-graduation in USA, which is called the Physician Associate program. It's a proper medical PG program. Only thing, it is a university program. There are almost 375 universities in United States. You go, you study in the universities, you pass, and you can be orthopedic surgeon, you can be gynecology. Particularly those who are going for surgical branches, opt physician associate over residency, because residency will require a higher level of profile for the surgical. You need to do at least 4, 5, 6 months of surgical rotations, which we can definitely provide for the surgical branches. But physician associate is a great program where you don't require USMLE, and you are a licensed practitioner. $150,000 to $2 lakh per year is the direct salary. You get priority H1B, non-cap H1B, priority green cards. Whether you do the physician associate or the residency, both are similar. They are the doctor's part. Other countries like UK, Australia, New Zealand and all, you need to clear the licensing exam, do 1 year of internship. You get a GMC license in UK or other countries, which is a normal license. You work in the hospitals, you keep on applying to the university. So you have to first build the profile. Profile building is same for all 5 countries. And then they will call you for the interview. Your selection is based on interview. Sometimes it takes 1 year, 2 years, 3 years again to enter, because you don't know what is going to be asked. Whereas in United States, it is a structure. So maximum people go to USA. It is a faster entry part of it, and it is a structured. If you properly make all the application process, US is easier admission as compared to that. But we handle all 5 countries. In fact, we handle 6 countries, Germany. For those who wants to go and settle down in Germany, Germany is again a free education, but all in German medium. So you need to take 1 year learning German, and that, but it can go, but that is not valid in India. So if you want to settle down in Germany, it is possible. We also handle the MD/MS admission in India. So if you are getting purely on merit, no donation, no management quota, we can get you the admissions here in India. We handle complete end-to-end processes. So whether you want to go to US, UK, Australia, New Zealand, Canada, or India, or Germany, we handle all these countries, handling this for the last 25 years. We are pioneers into that. We have the setup in United States. We have affiliated hospitals. We have doctors team in United States. We know in and out of the process into that. We know what are the parameters on which the residency admissions are done, and we will build your profile. So normally you should be joining with us from first year of MBBS. Because if you come from first year, we can do with a proper pace your research projects. We will do all other voluntary experiences. If you do third year and fourth year, you will be struggling into that because you are already overburdened at that. As early you come, we can do it in a proper. So most of the students with us who get a residency comes first or second year with us as early as possible. Last tip on USMLE. USMLE is now the clinical exam. As I said, if you diagnose a patient, you can treat a patient. So you should never be taking USMLE in second and third year unless you have got a 6 months of rotations in a hospital, in internship. Unless you've seen the patients, USMLE should not be attempted. Earlier times, before 2023, it was a theory. You could have taken it. Now it is not. And your step 2 CK, you should complete internship, go 2-3 months in United States, understand the American system, then you get step 2 CK. That is the best time. NBME has got good mock test. You can take the mock test and decide, because it's every week you can take the USMLE. Please do connect. My contact numbers are there. You can one-to-one, you can connect with me for counseling. We don't charge anything for counseling. You are free to connect with us. My informative videos and webinars are already uploaded on astutepromo.com. Please go visit astutepromo.com. To book appointment, astuteacademy.com, and you can book online appointment, or you can come physically to my Pune or Mumbai office, and we will be happy to assist you. Thank you very much, and do join us.